A local orthopedic surgeon is getting a hip replacement patients back on their feet quicker and with less pain.
But as News 13's Jay Siltzer shows us, the doctor literally made the tools to do it.
I had been limping for several years.
That's hard to believe when you consider 77-year-old Fred Brown has been doing yoga for 40 years. Still, he recently underwent right anterior hip replacement, but without having muscles cut because his physician helped design tools to reach the joint.
I've never heard of a doctor inventing his own instruments.
You know, it's actually quite common.
Not cutting the muscle is a huge deal, right?
Yeah, and it just makes the recovery a little quicker. You don't have to use a walker. Instead of using a walker for a month after the surgery, you just go straight to a cane.
Now, Fred is back in his studio in Flat Rock as a yoga instructor.
There was an emotional and mental elation that came with this new freedom. It was like I'd put down a 50-pound backpacker or something that I had been carrying for years.
Can you lift this left leg up? Keeping it straight. Good. Fine. Now the right leg.
My mobility in that hip is now better than it ever has been.
And there's only minimal scarring to show for it because of the anterior approach. In Henderson County, Jay Siltzer, News 13.
Dr. Das shares credit for designing the surgical instruments with Dr. Seng, who also is an orthopedic surgeon.